Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy, I'm a nutritional therapy practitioner, and I'm joined today, as always, by the brilliant I used brilliant last time. Dazzling.
I'm definitely dazzling. Yeah.
Dr. Martin, he's a board-certified plastic
surgeon. If there's any
surgeon.
word that describes me as dazzling.
Dazzle 'em. Dazzled.
I feel like people that are dazzling would have like sequins on and,
That's bedazzled.
Oh, okay.
That's different.
That's next one.
Yeah.
Should I get some scrubs that are bedazzled?
Is different than dazzling.
Yeah.
Yes. So we have a very exciting episode today, which I could not believe we had not covered already. So we've been talking a lot about plastic surgery myths over the last, 4 to 5 months.
Loving the format. It's
Liposuction myths. How have I missed this?
Yeah, there's so many liposuction myths.
This is maybe the most mythed surgery of all time.
Yes.
Like by far. The most myths of all time revolve around liposuction. So if you are listening to this podcast and you have a liposuction myth that we do not cover today, there are timestamps. So 1 through 10, you can find the timestamps below.
You just go to the myth that you want to talk about or hear.
You can, but if it's not covered, leave it in the comments.
Yeah.
And we'll cover it in a part 2. Because there are so many liposuction myths. I started with 10, but there are more. So you can also text me that myth. Here's the phone number, 303-630-9038. There it is. But yeah, if I have a myth that you have not covered, please tell me so we can cover it next time.
Yes.
All right.
Because we don't know if we have an idea of what the 10 myths we want to talk about, but it may not be your myth.
Well, and that's why I said, these are the myths that are maybe like the most common
For
myths.
us.
But
But, we'd love to hear yours too.
Who knows what else is out there? The internet's a big place. So.
Yes. It's a very, very big place, Amy.
Yeah. It is infinite.
Yes.
All right. So, Dr. Martin, you take the first one. This is maybe the number one myth of all time.
Liposuction is for weight loss, front slash. I'll lose weight from liposuction.
Yeah.
Yeah.
This is what people think. Liposuction is weight loss surgery. It is absolutely not. In fact, if you weigh yourself the day after surgery, you know what? You're going to weigh more than you did the day before.
It's very funny because we'll tell patients, liposuction is not a weight loss surgery. There's literally weight loss surgery. There's a whole subset of surgery that does that. And they'll come in the day of surgery. How much weight do you think you're going to take off? You keep going over and over that it's not going to be a big difference in your weight after liposuction.
Yeah. Or what size clothes should I buy? Like, your same clothes are still going to fit you.
Yeah.
So liposuction, even in cases where you're doing more of a debulking surgery, is not the goal to lose weight. I said that in the most backwards way ever. English is my first language. The goal of even debulking liposuction is not weight loss. It's body contouring.
Yes.
It's spot reduction, like things that you can't really do in the gym, but it is not weight loss. And if you're truly a candidate for liposuction and you have liposuction, your size may or may not change much at all.
If you take like the most kind of excessive surgeries we do with liposuction, where we go to the operating room, we take 3, 4, 5 liters of, aspirate out, which are big surgeries, that probably equates maybe to a pound or 2 at the most.
Even if it was 5, it's such transient weight.
No, I know, but like the fat does not weigh a lot, and you're taking it off in such a finite area that's not going to equate to a big weight swing, but it sure will make your contour look like you lost weight. And that's very evident even in small areas like the neck. If you take off, I don't even know what that
cc's.
Which I don't know what that equates to.
Let me tell you my
Does
thing.
that equate to like a 1/10 of a pound?
It does not, because volume and weight do not equate.
That's just
That's
if it don't fit, you must have quit.
Exactly.
That's what it sounds like.
Volume and weight do not equate. So you may take a 50 cc's off of a neck, which is a negligible amount of weight, but a person looks like they've lost 10 pounds.
Yeah. So that's the idea. You may not lose weight, but you will, in some cases, look like you lost weight.
Yeah, just improve your contour.
Improve contour of the flanks, go down your abdomen, gynecomastia, liposuction, arms, legs.
Even like something like saddlebags. Again, that might be a surgery.
Huge one. Yeah, it's a huge.
Where we don't take off much, but it makes such a difference in the way your clothes look. People are going to think like you had to have lost weight because your saddlebags are gone, but really you didn't. And people, I love it too. They'll come back in like, but really, like how much weight did you take off?
Like we're hiding it from them,
No.
Like before they come in, Amy and I are like, oh my God, they're going to lose so much weight from this surgery.
Like, no.
And they come in and like, I don't think you're going to lose any weight.
Yep. And initially after surgery, if you weigh yourself, even for the first probably month after surgery, your weight's going to be up because you're swollen. And that fluid has weight, as anyone who has, normal weight fluctuations throughout the month will tell you. Like water weight carries weight.
Causes injury, which leads to third spacing or edema. And that definitely will increase in weight.
Yeah.
Anyone who's ever had surgery and weighs themselves like a couple days afterwards, that healing process, you store fluid weight where normally you would not be in the soft tissue. They kind of float out there, and that definitely has definite weight to it. So your weight will go up.
That inflammatory process that happens is your body's way of protecting itself from further injury. It sees this surgery as injury. It doesn't know the difference, as we've talked about many times on our podcast. So it almost like is a self-splinting. So like if you've ever twisted your ankle, like it blows up to this huge size.
I hate that feeling.
Part of that is because your body is trying to splint that joint from additional movement.
I hate that feeling. I used to sprain my ankles before I was really like working on my calves. I would sprain my ankle probably once a year. And it's interesting that doing the calf work really made a difference. I'm absolutely convinced of that. So
just even things like squatting that increase your overall leg stabilization.
Yeah, I think it was just helping my joint altogether. And that feeling of swelling, because it is kind of somewhat stabilizing, is so annoying and so uncomfortable. So, and feels just not physiologic. Yeah. Don't have range of motion. You can't really move your foot in normal direction. So
take that and put it over your entire torso because you had liposuction all the way around yourself. And that's a fluid. That fluid has weight. So. And
Amy and I have talked about this 1,000 times. So you always get this thing where someone will come in and say, well, my aunt had liposuction.
Oh, don't jump on further myths. No.
Here we go. Good.
Stick to this
Stick
myth.
to number one. I don't want to be constrained by numbers, Amy.
On myth episodes, you have to be.
Okay. Sorry.
So go ahead and bust it because you're going to jump on other myths. We got to move on in a hurry.
I'm going to challenge Nils with the busted editing, but I'm going to do a normal busted now. Busted.
All right. Number 2, I will gain weight from liposuction, aka the overshooting theory. This is still not what you were getting at.
No.
So there are people, and for good reason, right? You think like, okay, well, my body has a weight it wants to be. So if I take out all this fat, won't it just regain it essentially? So this is where we go back to, this is not necessarily weight gain, but the overshooting theory of, will my body produce more fat to make up for the fat that was taken away? This was studied in a study that we've talked about on this podcast before, maybe in the All About Fat episode, where we talk about this. And it was studied in it was like 7 people, I think, who actually made it through the whole study. It was done in Colorado.
Well, at least that study we read. There was other studies.
There have been, but not many, and they're not great. But they did find in this, as long as you maintain your weight after surgery, your body has no innate drive to regain a set point of body fat percentage.
Yeah. So fat is basically a fat cell. And when it's
an organ system.
Right. So there's a cell. And Amy, what episode?
Phospholipid bilayer? Oh.
Yeah. What episode did we talk about cells?
So many.
But that was the one where I drew the cell, which I'm going to have Nils put right here.
It was in the research article, maybe? I had you draw it for talking about mitochondria.
Autophagy, mitochondria.
Oh, yeah.
Yeah. So cells make up our entire body, and there's fat cells. And when you gain weight, your fat cells get bigger. And when you lose weight, your fat cells get smaller. Your fat is what, Amy? What is it? A storage mechanism.
Also hormonal. We're finding there's more function than just storage, which is what we used to think, that fat was only storage.
Right. But fat in its baseline is the storage of energy. Unused energy, you can use the fat when you need it. Why do we do that? Historically, when we were evolving, you would not eat for multiple days. And if you had fat storage, you would live. So
that's also insulation against the cold, against injury.
Right.
Yeah.
So, the reality is that people extrapolate from there. Well, if you have a finite number of fat cells and you remove them, is your body going to want to replace them? Well, number one, your body just doesn't replicate fat cells. I mean, that's not an easy thing to happen.
It happens in rare instances,
right?
Like extreme overfeeding or when you're a child.
And secondly, at least for what we know, there's no mechanism for the fat cells to get bigger or smaller just based on the number of fat cells that have been removed. So that's kind of erroneous. Your body, getting into gaining weight or losing weight gets into caloric, deficits that may or may not be present, and then, calorie expenditure. So I think it kind of comes down to that. And that's what you see with all this stuff.
Yeah. And the overshooting theory specifically, and this is actually real. So this is a real phenomenon that happens in people who yo-yo diet aggressively.
Yeah.
You can actually, your fat cells grow and shrink when you gain and lose weight. Now, if you have been in an extreme calorie deficit for an extended period of time and then go back to not binge eating, but eating in excess, you can have this overshooting happen where in your body, instead of going back to where you're kind of at your happy weight, it overshoots it because it thinks that there has been a time of extreme famine. And so it needs to kind of overstore. And those fat cells grow much larger than normal. So that is real in mouse models. We've never proven this in humans, but in mouse models, that is a real thing. And you can kind of see why somebody might think that would happen, right? That maybe they understand they can't grow more fat cells, but maybe their fat cells would just get bigger.
Right.
And yes, if you gain weight, and that's why I did caveat that with that study, if your weight is maintained, your fat cells have no outside reason to want to grow. Like, and even though there's a lot of other things we don't understand about the fat way it functions in our body as a system, hormonally speaking and hormonally driven, like you will deposit fat in certain areas preferentially. So if you have a lot of, fat taken from one area, we'll talk about that in another myth. But still, there's no trigger. Like surgery in itself is not a trigger to make this overshooting happen or to make your body kind of fight back against the liposuction that you had.
Right. And it doesn't work in reverse. So if you take out fat, your diabetes won't get better per the data, really. And if you take out fat, maybe large amounts, but this with liposuction, your cholesterol is not going to improve. So, it's really a stalemate. It's not going to do one thing or the other. And that's what you need to understand. Yeah. With that said, we don't fully understand fat.
Nope.
And we don't
getting there.
Yeah. We don't understand fully what's going on. So we're not going to sit here and say we're the experts at this kind of stuff. I mean, the jury is still out, but definitely you're not going to gain weight just because you removed a few fat cells.
Nope. So this myth is what?
Amy, this myth is busted.
Yes, it is. Myth number 3. Here you go, Dr. Martin. Moment to shine.
Oh, yeah. Good. Perfect. My fill in the blank, it could be your friend's sister. It could be your uncle's friend's cousin who grew up in Texas and now lives in Mississippi, had liposuction on her arms and then got a fat neck, AKA the fat will go somewhere else. Like we talked about this before, the fat really gets into like one of those Mercedes Sprinter vans and just travels on up to your neck.
Or gets pissed off and grows more later.
I'm very unhappy with the belly area that you liposuction. I'm taking my fat friends and we're going up to the neck to deposit it there.
Yes. Yeah. So this is my jar of marbles analogy. So if you have 100 marbles in a jar and you take away 90.
I feel like this is like the ACTs.
Yep. There's still 10, right? Well, those 10 marbles are magic marbles because they have the ability to grow. However, it would take them growing huge to fill the jar, right? So if you have liposuction on your abdomen and we have taken 90 of your, in the marble analogy, 90 of your fat cells away.
And it's actually the analogy would be you're taking 2 of the 100 away, but that's fine. Right. Yeah. That's what happens in real life. Go ahead.
This is purpose for visualization.
Yeah. Okay.
And then you gain 10 pounds.
Yeah.
Well, now there's only these, 10 fat cells in your abdomen, but there's still 100 in your neck. So what do you think happens? Where does that weight doesn't go to your neck?
Your neck just got fatter.
All the fat cells in your body are signaled to grow at a somewhat equal rate. So areas that have more fat cells are going to show more fat gain than areas that have less.
Right. And by and large, if you have someone who's had liposuction and other areas get bigger after liposuction, I would put money on it they gain weight.
I would say that there is no other explanation for it.
There really isn't from
not.
A scientific standpoint. Now, there's obviously different cases. There's outliers. Things can happen. People have medical issues that can result in soft tissue accumulation in certain areas, but that would be
Well, they'd probably gain weight though if that was the case.
Right. Or they could have like edema or the lymphedema, the extremities.
That's not fat.
I understand. But like people saying that they gain weight, it's not the fat that causes something else. They have a goiter on their neck, et cetera, et cetera. Right. But in most cases, they gain weight. And that's, I don't know what else to tell you. Everyone loves urban myths. We want to believe that the fat is traveling around in their Sprinter van, but it does not happen that way.
Right. And again, like people who want liposuction on an area, it's usually an area that is resistant to weight loss and is kind of the area that bothers them, right? So let's say it's your arms.
Yep.
So you have liposuction on your arms because you can tell, like maybe you don't weigh yourself, but when you're kind of getting outside your comfort level because your sleeves start to get tight.
Yeah.
Okay, well, so you have liposuction and now you don't notice because your Q is gone. So it would take gaining a lot more weight
for
than
you to
normal.
See somewhere else.
Right. So then all of a sudden you're like, oh my gosh, like now I have this belly. But my arms are so skinny. Well, that's right, because we took all that fat away.
Yeah.
So it's not that the fat has gone somewhere else. You've not had the overshooting theory happen. Those fat cells are not freaking out. You've literally gained weight, and that fat has to go somewhere.
The way this should be worded is, oh my God, the liposuction really worked because my aunt's friend in Mississippi gained weight, but it didn't come back to the area that they treated.
Right. She still has a tiny waist, and now she has a fat neck.
But now she has a fat neck, but she has to get treated now or lose weight. So I feel sorry for all the friends, sisters, aunts that we make fun of all the time. So I apologize.
Too. And it's like 20 years later, she had a fat neck. I'm like, no, she needed a facelift.
Busted.
Do it. Yep. Bust this for everyone you know, please.
Yeah, please.
Yeah. All right. Myth number 4. Well, this is mine.
Okay.
I'm the evens today. Liposuction with technology can replace formal surgery. Sonabella, we're looking at you.
Yeah.
We'll be looking at you later too.
We got our eye on you, buddy.
Right.
Sonabella.
Sonabella adds, and let's hope there isn't one on this video. I always hope that there isn't, because I love the one where the woman's like, I got a Sonabella tummy tuck. And she's like, literally looks like she just put on a Spanx. Okay. With clothes on. Yeah, like, right. I'm sure your loose skin is all gone. The pannus is gone. Everything is gone. It's great. So if you truly need formal surgery of any kind, tummy tuck, thigh lift, butt lift.
By the way, this is coming from an office that specializes in liposuction with technology. Yeah. I mean, like, literally, that's one of our expertise.
We're like a regional training facility for these devices.
Literally.
Yes.
And we're telling you it does not replace formal surgery. Like, we're the place that people come to learn this technology and to learn how to do the procedures in the office under local anesthesia with you awake. And we're telling you on YouTube that it does not replace formal surgery.
No one is going to think, no one who needs a tummy tuck is going to get the same result with liposuction.
I don't know how many more times we can say this. I'm just busted.
But let me say this. Liposuction with technology is incredible. Like, if you are a candidate for it, oh my gosh,
it's
do
amazing.
it. It's amazing.
And to be honest with you, liposuction with technology has created
super awesome.
a larger subset of patients I can actually do surgery on. So but those weren't the patients that needed a tummy tuck. No. Those were patients that maybe would need a tummy tuck in the future, but we can kick the can down the road, do some of these things. Or it's people that need a tummy tuck, but they can't for financial or medical reasons. So maybe body type with liposuction is a great alternative for them. Okay. But it doesn't equate to formal surgery. The closest we come to that is in very small areas like face tight. And even those primarily are going to be only good for people that are younger with good skin quality. They wouldn't even need a neck lift to begin with. So it's kind of erroneous. I realize that we love technology. I realize that technology is what draws people in. But in reality, unfortunately, liposuction is not going to replace formal surgery.
Nope.
Busted?
All right. This goes to you.
Okay. Anyone, in parentheses, doctor.
Well, let's hope. Let's just hope that you're going to see a doctor.
Oh, any doctor
of some sort.
Any doctor, any, put it in parentheses, any physician or clinician can do liposuction. For example, man, you're just really calling out Sonabella today. I'm starting to feel bad about Sonabella.
I don't.
Okay, dermatologist, Sonabella, facial plastic surgeon,
your
ENT,
OBGYN,
your dentist, with the same results. Because God knows that all the training I did meant nothing at all. And, you can go there. Now, listen, don't get me wrong. We've said this before. Dermatologists, they've been in this game for a long time with the liposuction, for sure. Dermatologist Dr. Klein, who was...
Well, in inception. Current day dermatologists aren't taught liposuction.
No, but they maybe a little bit in their training programs, maybe a little bit.
Eye doctors certainly are not.
Definitely. So here's the issue, right? Yeah. Obstetrics doctor, or a dermatologist, an ENT surgeon.
Let me say one thing first before you get too far. This is just, PSA to everyone listening. If you have a medical license, you can buy one of these devices. If you have a medical license and $250,000, they will sell it to you. They don't care what kind of doctor you are. Literally, they do not care.
You don't even need the money. You just need a bank loan.
Right. So continue.
Okay.
Yeah. Just so we know, anyone with a medical license can buy this device.
So a lot of these subspecialties can do it, and some of them can do it pretty well, especially liposuction in the neck with a facial plastic surgeon. A dermatologist may have been taught, or they did special training in liposuction. Other kind of subspecialties, general surgery, some cases they can do it. And some people can do it well, right? But universally, okay, we're not talking about specifics. We're not trying to demean anyone that does this. But universally, all comers, plastic surgeons are taught to do liposuction. Half my training was in some way, form, or the other doing liposuction on something. And I would train for 6 years, So it's really not apples to apples. If you want definitive results and you want expert results, you're better off going to a board certified plastic surgeon, period, end of story. You don't have to. You can choose to go to other people, but to try to equate them is really erroneous.
Yeah.
Again, you could have theoretically a dermatologist or a facial plastic surgeon or whatever, a general surgeon who's better at liposuction than maybe a plastic surgeon out there, but that's not going to be the norm. Yeah. And you as the patient really don't have the inside information in most cases, right? So you have to kind of rely on their training, rely on the reviews, go to the office, get a feeling about it. So then why do people go to people that maybe aren't trained in liposuction to do liposuction, Amy? What would be the reason that they would do that?
Well, I'd say the number one reason is because they lie. And we've talked about this before on our podcast. There is no rule or law or person stopping any doctor from calling themselves a plastic surgeon or a cosmetic surgeon. So you might go to an eye doctor who is calling himself a plastic surgeon and you don't know any better unless you do the research to find out that that person is not indeed a board certified plastic surgeon.
Right.
Cosmetic is the word that gets thrown around a lot. Like we're
and they'll even
cosmetic
have
surgeons.
board certifications on
for cosmetic surgery.
And those
the
are
same.
in some cases even only weekend courses. In other cases could be only a couple weekends and stuff like that. So
is not the same.
Again, we're not trying to diminish physicians and trying to tell them they shouldn't do what is legally okay for them to do, but you as the consumer need to be very educated, and that's extremely important. And the second reason you're going to go to these types of places is another reason, money. You're going to choose the lesser expensive option.
Or the one offering a Groupon.
And which is fine because some people, number one, they don't have a choice. And secondly, some people just really focus on money. That is the primary thing they're focusing on if they're doing elective surgery. And buyer beware on that, right? So you have to do the research. We have a great episode on how to select your surgeon. Is that what it's called?
Yep. And also why board certification matters.
Why board certification matters. And it's really important. And that's Amy and I's stance. So we feel strongly about that. We're trying to be.
What I find so interesting though is people are like, oh yeah, like they trained in this. That would be like me just buying the equipment for you to be a dentist and being like, he trained in this.
Right.
No. And like people would be appalled if you were doing that. They would be shocked if you start calling yourself a dentist. Right.
Right.
But
yeah, it doesn't work in reverse.
no. And so like
so
why?
me as a plastic surgeon, just telling everyone I'm a dermatologist.
Right, I'm a
they'd be like,
podiatrist.
no, you're a plastic surgeon. You're not a dermatologist.
Right, like, I'm gonna do-
Well, that's weird. But like it seems like everyone,
and unethical.
like
Can you
everyone's.
imagine?
I think Nils even called himself a plastic surgeon last week.
But that's
No,
that's
you called me.
that's
I
my
called you a
point
plastic
though. Like
surgeon. That's right.
it's
That's okay if I call you that.
trying to make this mainstream acceptable that just anyone can do these procedures. The same is not in reverse. I mean, like, yeah, like we're doing podiatry now. Like, oh, come on in. Like, sure, that foot thing looks fine.
Yeah.
Like, I don't know why people think like that just, oh, anyone can learn lipo, but what, just anyone can't learn neurosurgery? Like, oh yeah, I think I could start doing neurosurgery. Like, let's just do it.
But yeah, you wouldn't do that.
No.
There's something in our culture that allows people just to say, and I don't think it's because
And
they're
a lot of it's money.
No, I
on
think
both
it's
sides.
money, but I think it's also a little bit ignorance. I think there's not a lot of sourcing of people when they go in to see doctors. They don't do their research because in reality, if you want to know your doctor is a plastic surgeon, like a true
Plasticsurgery.org.
plastic and reconstructive surgeon, just go on plastic surgery.
Plasticsurgery.org.
Yeah.
We have that in
Yep.
all our links has a link so you can go.
Oh, I didn't know that.
Yep. Plasticsurgery.org.
Every episode? Okay.
That's in our-
Nils was telling me we put the plasticsurgery.org link in every one of our episodes. Again, we're not, Amy and I know it sounds this way because I'm a plastic surgeon, are not like so pro plastic surgeon that we think that every problem in the world could be solved by a plastic surgeon. There is definitive issues that a facial plastic surgeon that can do better than a plastic surgeon.
Or a podiatrist or an OBGYN or a
Right.
spine surgeon.
So
Stay in your lane.
right, and it's okay if things want if the playing field gets muddled because that's our reality because there are no regulations and there's no federal mandate that you can't do that. But you as the consumer, as the person who's literally getting surgery, it would be in your best interest to at least source and understand who you're going to, what their training was, how many surgeries they've done, what their outcome has been, look at their pictures, understand what you're getting out of this before you even talk about money, right? And so, yeah, it's a little more expensive probably to come to me. I am the expert in some of these things. So you're paying for what you get. I think it's very, very important. Now, if you choose, because you're fully aware of everything that's going on, you choose to go to some of these kind of surgeons, that's okay. That's on you. We support you. But if you have a problem, you can't go back and say, well, I don't understand why this happened.
Well, that's actually what I was just going to say is liposuction. We see patients every week who've had liposuction with an undesirable outcome. I can't think of one of them who actually had it with, well, that's not true. I mean, occasionally it is with a board certified plastic surgeon, but it's usually not. It's usually a Sonobella situation or something else. And in a lot of those cases, you can't put the cat back in the bag.
Right.
I mean, you can add fat back into an area that's been over liposuctioned, but it's devastating to see these bad outcomes and for us to be like, ugh, I mean, it's tens of thousands of dollars maybe to fix this now.
Right. And
If we can fix it at all.
to be very clear, Sonobello's business model is they hire surgeons. Some of them are plastic surgeons. Some of them are board certified plastic surgeons. And some of those surgeons may be very talented at liposuction. So we're not, as a business model, Sonobello is not doing anything inappropriate. They hire surgeons that have at least some sort of training with liposuction, but it's not always going to be a plastic surgeon, or it's not always going to be a plastic surgeon with a lot of experience. And the reason is those business models don't pay those surgeons a lot. I mean, they really don't. So, why would you go work there? Well, maybe you're not as successful. You're just starting your practice out.
Or you're ready to retire.
You're ready to retire. That
Best
kind of
case
thing.
scenario, it's somebody who is ready to retire.
Yeah. And you just don't want to deal with, paying office staff and, dealing with running your own business.
Come in and do surgery and leave.
Maybe, I'm sure there's cases, some people just run into bad luck and they just need a new start. And so they go to a place like Sonobello. But you're not really picking, my understanding of those places, you don't really get to pick your surgeon either. You just go who's ever on call that day, or, whoever's assigned to you as the patient. So Amy and I care deeply about patients and their outcomes. That's exactly why we've been doing this for 5 years.
Education.
Yeah. And we just really want you to be fully aware of what you're getting into.
Yeah.
And that's what's most important.
Right. If your plastic surgeon or cosmetic surgeon is actually an eye doctor, you should at least know that going in, not coming out. Yeah.
Or maybe you don't care. So
Or maybe,
good luck.
or seriously, maybe you don't
Good
care.
luck.
Maybe the dollar sign is all that matters. And fair enough, but this is our ability to educate people. So
Yeah.
any doctor can buy this device. Any
And you
doctor can
this
call
is very
themselves a cosmetic
analogous to
surgeon.
going overseas and having surgery too, by the way. You could go overseas unless you have definitive knowledge of the person you're going to see. You can source that person. You have family that lives there, and you know for a fact that person is very talented. You go overseas, you can do this. You have no reciprocity. I mean, it's like you're stuck, and so you need to really think twice about what you're doing if you're just doing it for money.
Yeah.
So,
All
okay.
right. Let's take a break. Halfway through, we're coming back for the back 9, back 5. We'll be back in just a minute. We're back. I feel like you were going to say something, but
No, I just want to tell everyone I'm a podiatrist now.
right. Yeah, well, and I'm a board certified plastic surgeon, so,
It's awesome.
Yeah, it's awesome. It's
I feel like
great.
it's Halloween.
Yeah,
We can just be
it's
whatever
fantastic. Yeah, I am a supermodel.
Yeah.
Close your eyes.
we want. Yeah, I'm George Clooney.
Yeah.
I want to be George Clooney.
You're better looking than George Clooney is
Oh my
now.
God, George Clooney is like everyone's.
You want to be 90s Clooney.
Yeah.
Those guys, I don't know. Like I look back at the kind of,
Maybe it's just not just how he
Beta
looks. It's kind
guys.
of his. Yeah, it's kind of his like overall affect.
maybe.
Seems
I don't
cool.
know. I'll take the Viking.
Yeah.
Yeah. So I can't remember what I was going to say. So we'll just move on. Oh, no, I do. So, like NFL, they do, we've talked about this. I like watching NFL Network and they do angry runs. I feel like there should be some type of icon for angry Amy rants
Yes.
that comes up
Oh, yeah,
occasionally. Yes.
We've
like
got those.
rant alert because
Yeah, they're always. Yeah, you always throw the same people under the bus. If it,
they come up from time to
Yeah.
time. I get ranty about something.
by the way, the angry runs thing, he always has that thing in his hand.
Yeah.
What is it?
it's the marker stick.
Oh, it's a marker
Yeah.
stick. Yeah.
Yeah.
It's weird. When I work out, that's always on.
Yeah.
And you always see that guy, whoever that big headed guy is with all the hair, and he always has that stick in his hand for the angry runs.
Angry
and
runs.
he's like very animated.
Yeah.
Yeah.
So we need angry rants. Okay. Back into the podcast. Here we are. Number 6. I'll see my final results right away. Parentheses, all my swelling will be gone in a week.
Of course.
Magic.
Yeah.
Yes. My favorite is somebody 2 days after surgery who's like, am I still swollen? I'm like, oh my gosh, like you're going to get more swollen. Like you're not even as swollen as you're going to be. Your swelling hasn't even settled yet.
Yeah.
It hasn't even made itself at home yet.
It is, if you violate that much tissue underneath the skin, you're going to have swelling for a long time.
Even in a tiny area like the neck,
Yeah.
you know? Like swelling, will you see your final results right away? No. I mean, like final results, 6 months to a year, depending
Yeah.
on the extent of
6
your
months
liposuction.
at the earliest.
Mhm. And the amount of technology that was used.
But the difference between 4 and 6 months maybe is 5%, but it's still not the final
Right.
results.
And that's the kind of finishing, the things that like you won't notice. But what that really is, I think, is when you don't notice this cycle of inflammation that can persist. We talked about swell hell on our tummy tech episode. We also talked about our tummy tech myths, like swell hell is real. Swell hell happens after liposuction. Like you will think all your swelling is gone.
Yeah, that was a confirmed.
Yep. And then all of a sudden, oh my gosh, I'm swollen again. You know, we've created space.
That was not a plausible. That was
Oh,
a
that was
confirmed.
confirmed. Yeah. All my swelling began in a week. Like that's, and then, not only 2 days after, then a week later, they're like, well, so am I not swollen anymore? Because it still looks big, or it still looks like this. I'm like, yeah,
why am I still fat?
Swollen. Yeah. Why am I still fat?
Why am I still
Did
fat?
he take it all? Like, I'm like,
What did he do?
Yeah.
I don't know. Well, we showed you the fat when you were done.
like, I threw your fat in the
it's
trash.
out.
Yeah, your fat is gone for good.
We took a picture of it if you want to see it again.
Yeah. So swelling is real after liposuction. When we talk about all about liposuction, our episode where we talk all about liposuction, one of the things, it's like swelling, more swelling, even more swelling, I think is one of my slides, because you will be swollen. And some people swell more, some people swell less. The size of the person has nothing to do with how much they swell. A friend of mine, super tiny, swells like crazy anytime she has anything done. Like, had an orthopedic surgery, like knee 8 times its size, like way more swollen than you expect a larger person to be. She weighs like 90 pounds. So swelling is
She was all knee. That's what we
yeah,
would say in those
it pretty much
situations.
was, yeah, like just knee.
Yeah.
So, the size of the human, like some people, especially I think that is surprising, like a larger person, there's more dispersion of swelling. So they may not look as swollen as a tiny person.
Yeah.
Some people just swell a lot. Like might just be you. So you will not see your final results right away. In your mind, think 6 months. And your swelling will not be gone in a week. Bulk of your swelling will be down in about 4 weeks, like to where like you're not feeling like you're super swollen anymore, but you are still swollen. And something I always point out to people who are kind of asking about that, I'm like, feel this skin right here. How it feels like you're touching a sponge. Whereas like then feel like the skin on your arm, like where it feels like kind of connected in a way. You'll understand this more if you've had liposuction, the way your skin can kind of feel disconnected a little bit.
Totally.
So that usually is followed up by my not swollen anymore, but like I'm still numb. I'm like, well, yeah.
So Amy, just off the top of your head, 3 things you can do for swelling after liposuction. You got 5 seconds. Go ahead.
5 seconds. My number 1 would be hydrate and ambulate. So walk, make sure you're hydrated, make sure you're going to the bathroom enough.
Number 2?
Number 2 would be cryotherapy and hyperbaric
And number
therapy.
3?
Acupuncture.
Okay. What about light therapy?
No, that would not be on my top.
Okay.
That wouldn't even be in my top 5.
Hater.
Not that there's anything wrong with light therapy. They're just things that are more powerful.
I got you. We hear
Yeah.
you. We hear you. Okay.
Yeah.
You ready?
I'm ready.
Hold on. Busted. See if Nils
these
can edit
episodes
that
are
out.
just fun.
Yeah.
All
See if
right.
you can edit that out.
Number 7 goes to you.
Amy, you can / should do liposuction of the actual butt.
Yep.
Of your buttocks.
That's what people like friends of mine be like, oh my gosh, like I need liposuction on my butt. It's just so big. And I'm like, you wish, as I'm like doing hip thrusts with 350 pounds trying to grow my glutes.
Yeah. Number 1, this is like a little bit a throwback to the 2000s because now everybody wants butt contour, but there are
However.
a subset of patients who, in my experience, are skinny that come in and want their butt to be small.
Yeah.
I don't know what it is or something in their brains that has them focus on their butts. So, Amy, why can't you? I mean, I guess you technically can.
You
technically can.
The should is why I put should in there.
Yeah.
And this is where you really shouldn't lipo the actual glutes. Now, I guess I should have put at the bottom of this myth, like, what about reversal of a Brazilian butt lift? But we can kind of talk about that secondarily. So let's take a patient who's never had surgery on their butt, ever. And they think their butt's too big. It's usually a combination of what I would say 2 things. Women with saddlebags a lot of times will think that that's their butt because it's changing the contour of their posterior appearance.
Yep.
So clearing out their saddlebags, clearing out their flanks. This is what I love in people who don't want the butt size of their butt changed. We clear their flanks out, which is like that, the top part of the glutes and the low back. And they'll be like, what did you do to my butt? It's bigger.
That's what we call the back butt. Yeah.
Like, no, your butt's not bigger. It just looks perkier and rounder now because we cleared out the fat all around
so
it.
You think about it, you had to clear out the frame, whatever frames your butt. So your flanks and your saddlebags, you clean those out. It's going to make your butt look better. And in most cases smaller. It's just probably look a little bit perkier.
Like shapelier for sure.
If you're going to do liposuction of the butt, you can only do the upper third. You wouldn't do anything else.
Maybe a little bit on the outsides, but that's going to make you look weird. Like those the do
so
not
you
do
have
not
to
go
be very
zones.
careful, but definitely the lower 2/3 of the butt, doing liposuction there is totally problematic. It can cause the butt to sag and have undue contour deformities, which would be way worse than having a butt that's slightly bigger than you want.
Yeah, I think in all the cases where we've had like abdomen pretty bad too, but the most bad outcomes when people come to see us from having liposuction somewhere else is around the banana roll area, the lower third of the buttocks and or the hip dips, because it's tempting, right? You see it. Like you see somebody standing there like, oh yeah, I could lipo right there. Don't do it. Like when we mark patients before doing like inner and outer thigh lipo, Dr. Martin will mark at them standing with red in the area to not go.
We got to give Nils a picture of that.
Yeah.
Do
of
we
the
have
markings.
something? We have. Well,
We
maybe
definitely have
don't.
pictures of the
Okay.
markings. Yeah.
Well, we'll find a picture of markings with the red on there. Yeah, and you'll see the red is right underneath the gluteal crease because you do not want the butt to fall, especially on Caucasian
Well, that and on the
females.
sides, the
Yeah,
hip
on the
dip.
sides,
That's where
yeah.
people think they need lipo right
over
there.
your trochanter.
Yeah.
and over the hip joint. So
Yeah, once that butt has fallen, so if you lipo aggressive and even moderately on that banana roll or right where the kind of butt and thigh meet or that lower part of the buttocks and the butt drops right there, you can't go back.
yeah,
I mean, like the fix for that is either adding a lot of fat back in, which in most cases, the person who has that presentation doesn't have any more fat to give, or at least enough fat. And that's not a safe place typically to inject fat.
it's a weird feeling when you come in with a banana roll, which is the base of your butt, the crease of your butt, and you have more fat below that.
Then above it,
You go to an inexperienced person, they liposuction that area, and then they make it worse because
Drops.
it looks more like saggy skinny than fat. You have to actually add fat back in. So the answer to a banana roll is actually fat grafting below it, which is crazy. Now you can treat banana rolls like very conservatively with a little bit of body type, but you have to be very careful.
and
Very,
more
very
focus
careful.
on the inner and
Yeah.
outer areas versus the
Yeah,
middle.
this is one of our teaching points that we
Yep.
teach a lot at our higher level of teaching, like master's level. So you
Yeah.
just don't liposuction the banana roll.
Or even just the bulk of the glutes is not a good area. And there's safety concerns with lipoing that area too. You have major blood supply, you have a lot of muscle, and there's not as, there's very thick, dense muscle right there. That if you are to violate that muscle, there's also really big, meaningful blood vessels underneath there.
Yeah. And that's where with BBL, you can see our BBL episode, we talk about the risk with BBL is those blood vessels. You get fat in there for injecting fat, cause a fat emboli, and that's very deadly.
Yeah, and for that same reason, we don't inject fat in that lower part of the butt either for that very same reason, or directly up in that direction. We always come down.
We always come down.
So, Dr. Mark, what would you do? So let's say we are in this new world of women who, Kardashianed it up and got a huge BBL.
Yeah, you could do some, definitely some liposuction in the upper butt if you had to. It'd be very conservative.
Yeah, because you're going to have skin laxity issues when you take that out.
You always have the skin laxity concern. So if you take fat out of your butt, you could have a saggy butt versus a big butt. And by and large, people like big butts better than saggy butts in our experience, anecdotally speaking. But so it just depends on the presentation. But it is possible. This you could say this is a plausible one, but I think it's still busted because in reality, changes my feeling about the statement. I don't think you should do liposuction there unless you absolutely have to.
Yeah. Yep. So this one is
I think it's busted.
maybe a little plausible, but only
Maybe.
in weird situations.
In a small plausible.
Right. Tiny plausible on the side. Asterisk plausible-ish.
See how you get that.
Plausible-ish. Yeah. All right. Number 8.
Poor Nils.
Compression garments can fix a bad result. Or we have the patient who comes in, has an outcome from another surgeon with their lipo and says, well, if I just couldn't wear my compression garment as much as they wanted me to, and that's why this happened. And I'm looking at them like, no, that's not why this
There's
happened.
no data that shows compression garments make results better. No. Now, if you do super high def, like really high end, kind of very difficult liposuction with contouring, very superficial contouring on the skin, maybe foam pads with compression garments might make a little bit of difference. I have a hard time buying that too. But standard liposuction, what a majority of people get, I don't think the compression garments make any difference at all.
Well, statistically, that actually has been studied and proven. At 6 months, your result is the same. Now, we love compression. Compression is great. It makes you feel like a safe little swaddled baby.
I mean, I wish I could wear compression all the time.
It also, I'm wearing compression socks right now. Like, there's benefits.
really?
Yeah, look.
Flamingos.
See, Nilsson. Yeah. I could stick my leg up, but that would be awkward. Yeah, I'd be real weird on my leg just showing up right here. So yeah, compression is great for a lot of reasons, and it feels really good after surgery. Your compression should feel good. If your compression is feeling painful, well, then that's not a good fit for you. Like, that's not the right compression. Bad compression can definitely make your results bad. Good compression will never fix a bad result. But if you're wearing compression that is ill-fitting or digging into an area that has just had surgery and is like causing ridges or cutting into that surgical area, you can make that a permanent thing.
Yeah. So I don't want to burst anyone's bubble who's had a bad result, but bad results come from bad surgery.
Exactly. Not from you
So
not
when the
wearing
doctor tells you it's your compression problem, they're just completely FOS.
Yeah,
So,
we had a patient who
unfortunately.
told us that her doctor wanted to wear literally a cutting board inside her compression garment. And she's like, it was just so painful. I'm like, yeah, like no amount of compression can fix a bad result. Like Dr. Warren said, if you have a bad result, something happened with your surgery.
Yeah.
And if your surgeon shames you for not wearing your compression and that's why your result is bad, like you need to start looking around for other options.
We have had results, people afterwards with the healing, they get seromas, they get some weird inflammations, even like a low-grade infection. That can affect results, but that's a definitive reason.
Right.
And that
had nothing to do with compression.
Right. Me as the physician would say, oh, you remember you had that seroma or you had this infection. That's probably why you have this presentation now. We'll have to fix that little area or something. But just to ad hoc say that anyone who doesn't wear compression is ruining the results, to me, is very self-serving to the surgeon.
Yeah. Or
and
surgeons who want people to wear compression for 6 months.
Yeah. And listen, people that go into surgery, can we just be honest, Amy? Can we be honest on this podcast?
We are.
Or this YouTube video, whatever we are. We're stuck in the middle. Surgeons are, algorithmic, type A, Asperger-y kinds of people. They like to do repetitious things. It makes them feel comfortable. And if you decide in your brain that the compression garment makes a difference, you will it into reality. Okay. But the data does not show that. And that's the beauty of science. Overall, you can do all these intuitive things and things with your experience. And I do the same stuff. I'm just as guilty. But science ultimately will tell you if it makes a difference. And what we've read, it does not make a difference at all. And to be honest with you, we've seen it with our patients too. So
and we recommend compression. Like we do recommend
compression. We're very
compression.
pro, yeah.
Yeah. So
we're pro compression.
Smart compression.
But it's not going to fix results.
No. And we're never, yeah. So compression garments should be comfortable. Anything that's compressive is going to have some of a feeling of you having it on, but compression done well absolutely helps with pain. Your body has pressure and pain receptors, but can only really understand one at a time. So putting pressure on an area that is in pain can definitely deaden that pain cycle. It's very soothing. That's why we swaddle babies. It's calming to our central nervous system.
That's why I wear my weighted blanket. I love you weighted blanket.
Exactly. Like I love wearing my compression socks. So yeah, compression is great. Like we love compression, but anyone who tells you that you're
can we just do an episode with weighted blankets on?
There's one in your office. Go get it.
Let's do it.
You wear like a cape.
Yeah.
Yeah. So what is
I'm
this
sure
myth?
that would not be received. Oh, I'm sorry. Amy, this myth is busted.
Busted. Yes. All right. This one goes to you.
Okay. Amy, men do not get liposuction.
Busted. That is so not true. Men get liposuction all the time.
Yeah.
Yes. I mean, I would
do liposuction right now.
Yeah. Men may not talk about it as much.
Yeah, I know.
Yep. But men get liposuction, and the ones who do are like, they love the results.
Man. We've established that in a previous episode.
You are a man. Listen to our top 10 or top 5 of 2022.
Amy, I'm a man.
You are a man.
Yeah, thank you.
I am a man.
I was just reaffirming.
Yes. Seriously, listen to the top 5 of 2022.
I don't know if you're allowed to say that now because of this gender stuff.
Actually, you absolutely can.
Okay,
you should say that.
I am a man.
Yes. Thank you for clearing up that confusion.
Clearing this up.
Yes. Men get liposuction. I would say the top 2 areas men get liposuction are on their neck and on their flanks.
Yep. And their belly too.
And then abdomen would be number 3.
Yeah.
Yeah. Men get liposuction all the time. They're great candidates for it. Sometimes, in some cases, men are better candidates for liposuction than women because they have better skin integrity.
Better skin. Sorry, ladies.
You can lipo a man a little bit more aggressively than you can a woman in some instances because they have better skin integrity. They also don't tend to have as much of a hormonal distribution of fat, especially men younger, I'd say under 60. Men over 60 tend to have more of that pot belly appearance if they're developing some underneath the organ kind of fat, which we talked about.
Which we call visceral fat.
Yeah, that fat you cannot liposuction. You kill a person if you try.
You can take it out. It's called an omentectomy. Mm-hmm. They take it out sometimes with cancer. And we've said this before, that omentum is there to protect your body. So if you were out in the wilderness and had appendicitis and formed an infection and inflammation, that omentum would wrap around where your appendix is and seal off the infection so it doesn't travel in other parts of your body.
Also keeps your organs insulated from injury. And
it has blood supply in it too.
Yeah. So it's important. But men get liposuction all the time, just like they get all the other surgeries we talk about, literally all of them. And they're great candidates for it in most cases. This was an easy one. Bust it.
Busted.
Get your liposuction.
Yeah.
Do you, boys. All right. Number 10. Here we go. I saved the best for last. Liposuction doesn't hurt.
Confirmed.
Liposuction is
confirmed, Amy.
Probably up there with the most painful procedures.
If you look at our website, jasonmartinmd.com, we confirm this myth.
Yeah.
When I do liposuction, it does not hurt.
My favorite is if we are doing a surgery on an awake patient, Dr. Brown will be like, so much does this hurt? Like a 2 or 3, and the person's like, 7.
And then I say what I always say, if you suck it up, I'll suck it out.
And this isn't hurting me.
Which came from a nurse I worked with, which I always love saying that.
Tinkerbell, yes. So yeah, liposuction hurts. It hurts for a long time. It hurts for longer than you expect. If you want to find out how much I'd like to talk about this, is go listen to our episode all about liposuction, because liposuction swells and it hurts. Those are two universally true things. Now, pain is subjective. And also, I'm not saying it hurts so bad that you can't function, but you will absolutely be turtling the first week, especially if you have liposuction on a lot of areas. Turtling just means that your life is happening, but it's happening slowly, right? Everything happens. It just happens more slowly. You are the turtle. And that might be in ways that are not perceptible to other people looking at you. Like if you had liposuction on your arms, it may take you a while to put your shirt on, but once your shirt's on, you're functioning like a normal human the rest of the day. No one knows anything happened to you. If you have liposuction on your flanks, getting in and out of your car is going to be like straight up torture. You're going to feel like someone is pouring hot lava all over your back as you
You're
slide against that car
so
seat.
delightful.
But once you're sitting down and driving, you're going to feel fine.
I don't want liposuction anymore, Amy. I just want to say that.
Yeah, but once you're sitting and once that pressure's there, the lava goes away and you're feeling fine.
It's all like your headspace. So sometimes I'll do liposuction to get fat grafts for people with breast cancer. And you'll tell them beforehand it's going to hurt where you do liposuction. And afterwards, they all say universally, man, that hurts where you did liposuction. But it's where their headspace is. Obviously, for breast cancer, they have breast cancer, or they're getting reconstruction. Their headspace is different for reasons that we all would understand. It's like a traumatic experience. And it's interesting that you take a liposuction patient like, oh, it hurts. And in most cases, like, well, I get why it hurts because I'm going to look better. So it's about the payoff in the end of that discomfort.
Yeah. Or if we do like a little bit of fat transfer with a facelift. The person who just had a facelift, right? They think this is so scary and so big. 3 days later, they're feeling no pain from their facelift, but oh my goodness, where he took the fat off my abdomen hurts.
What did he do there?
Yeah.
Well,
like
I did liposuction.
And we got like 10 cc's of fat. This was like baby liposuction.
I always wonder, because we have these videos and we show liposuction. Every time we're editing them, or like Nils gives me a video, I'm always like, oh, should we put this out? Like, so people can actually see. And of course we do, because that's what we do. We try to tell you the truth. It does look kind of violent. And there was one video recently that Amy was like, as you could see, you said something like you could see how much the surgeon has to work when they're doing it. Mm-hmm. And like, it's literally the video's panning to me, like basically out of breath and almost sweating. That's how much work I was doing.
Right. Fat doesn't want to give it up. Some people's fat tries to stay there. Yeah.
And I always wonder, like, if you go see a surgeon, board certified plastic surgeon, and they do a lot of liposuction and they're like severely overweight, I'm not sure how that would work.
They use the PALs. They're barely doing anything.
Oh, okay.
They're just turn that PALs up to 11 and just,
it's a lot of work.
It's a lot of work.
Yeah, you burn calories.
You do. And doctors who don't do a lot of liposuction, when they do, they're like exhausted.
They're miserable.
I saw one just the other day who did not do a lot of liposuction. It just come out of an arms case, which is like the easiest liposuction ever. And was
to me, like, if you tell me I'm doing an arms case,
we do like 8 in a row.
Easy.
This person was like exhausted. Yeah. Like literally looked like they'd just done like a marathon. I'm like, that little bit of arm lipo?
Yeah.
Like, you got this.
You got this.
So yeah, liposuction hurts. It hurts for several reasons. Let's explain like medically why liposuction hurts as much as it does. So let's start out. We have a space that's this big and it's full of fat. First thing we do is we blow it up
about an inch apart
to this big. Listening. Fill it up with fluid.
Now she just did 3 inches apart.
So now there's a lot of space there. And then we go with a cannula, which is basically like a big straw with suction on it, and we just go in and just start sucking fat out. Well, so there's other stuff in there. And this is where I've talked about this with healing. People don't ever ask me about that. They ask me about the skin. Am I going to have a scar? But they don't ask me like, what about my nerves? What about my lymphatic system? What about my tiny little blood vessels? All those things are in this space that is now all stretched and freaking out, especially like your nerves, right? All these connections to the skin were like, whoa, like we like being here. We're good here. We don't like being here. So then surgery's over. Inflammatory fluid makes the space even a little bit bigger. And everybody's angry, right? That's why it hurts. Like until that gets back to this, your body's going to be like, what is happening here?
Totally.
So.
The otother equivalency would be.
I'm like the magic school bus.
Yeah, I know. What about this one? So spaghetti in a bowl of water. The more water you add, the spaghetti goes further apart. Mm-hmm. And, that's the other analogy. So the fat would be basically the equivalency of water in between the spaghetti. But if you have a bowl of spaghetti and you stick like a wooden spoon into it with water in it, the spoon will not cause the spaghetti to split apart. The spaghetti kind of moves around, and that's what your blood vessels and nerves do. Mm-hmm. But the more water you get in there, which is edema or swelling, the more stretched those nerves are and all the systems that are in there, including the blood vessels too. Mm-hmm. This is very irritating to your body.
Yeah. And plus there's been, in some cases, abrasive injury kind of on the inside of that fascia. Some cases,
yeah.
Well, with you, it's always.
Yeah, and then you're releasing all these factors that cause inflammation. Yeah. So, and that cascade, that wound healing cascade is super complicated. We've talked about that many times before. And then these monocytes and neutrophils that come in and release all these cytokines, and these cytokines lead to really bad inflammation and pain and discomfort.
And part of that pain is your body being like, hey, something happened here. Like, stop doing that.
Yeah, it has a physiological
Don't move.
benefit.
We're trying to figure out what to do here.
Yeah.
Like, that pain signal keeps you from causing what your body sees as injury, further injury.
Totally.
So like, stop it. Like, we're going to make this hurt, so you stop doing this. That's why compression, though, feels nice, right? If you think about that, like, that compression puts pressure here, like, oh, we're okay. Like, we're all good.
We're doing good.
Like, we're okay.
Hey, thanks.
Like, yeah.
Keep this on.
Yeah, like, don't take this garment off ever. That people will complain about ill-fitting compression. People will complain about good-fitting compression. People are like, like, can I keep it? Can I keep wearing it?
Yeah, again,
it makes me feel
we
safe.
keep saying the same thing we say over,
Yeah.
but we had that patient that came in a year later.
Well, she was doing it for triathlon training.
Yeah, she's doing it for a triathlon training, which
'cause it
I just
helps with
totally love
swelling.
that.
Yeah.
With the compression garment on.
Oh, yeah. I mean, that's why I'm wearing the compression socks. It helps with swelling.
I'm going to say this is, should I say?
But not yet, because so why does it hurt for so long then is the question. Like, people will come in like 3 months later, like, oh man, like, it still kind of hurts. Like, if I do certain things, like if I stretch a certain way, or like, my husband came up and slapped me on the butt, and that really hurt still, like they hurt because it's a lot of space your body has to repair.
Yep.
And also if we add in, like, we didn't even talk about adding in energy and heat, and that's causing collagen needing to form, like it's causing internal damage, like it causes a little internal fire, right? Not real, but like heat. So all those things take time to heal, and that time in people's heads, because they're not seeing it, right? All this is happening on the inside. They see this tiny little poke mark that we made that looks totally normal a week later. Like, if the skin is healed, why isn't everything underneath healed? That's kind of what people think. Like, that process underneath is months. I tell people, like, plan on knowing that something happened in this area. It's like you're in pain every day, but you'll know that something happened to you in this area for probably 6 months.
And it definitely happens more with activity.
Yeah. And movement and like doing stuff, or like if you fall, or just normal things. Like, it's not like you're at a 10 on the pain scale, but you're like, oh yeah, that's right. I had lipo there 6 months ago. Still feel that a little, life goes on. You turtle right away. Like, none of this stuff prevents you from functioning like a normal human for the most part, but it's going to be sore for longer than you think.
No pain, no gain. All right.
Now it's busted.
Busted.
All right. Well, there we go. Liposuction myths. Like I said, this is just scraping the very, very tippy top of
I have
this
like 20 more in my head
liposuction
already.
myths,
Yeah.
right? There's so many. So please leave them in the comments or send me a text. You can text me at 303-630-9038. All of our social media handles are here. And I would love to hear other myths. Like, myths are kind of fun. And like, sometimes I wonder, like, where did they start from? Other times I know. I mean, like when we talked about on brachioplasty, like the whole, like, you can't shave your armpits or you can shave your armpits a week after surgery. Like, no, you can't. Like, some myths, I get it, that they kind of spread, and the fat neck thing, okay, I get that because that person gained weight. But other times a myth, I'm just like, what?
I know. Like, where do they come from?
Well, like wearing a cutting board under your garment for 6 weeks or for 6 months. Like, what? So yeah, I love busting myths.
That was really good.
That's good.
Yeah.
Yeah. Rigo payer taxes. It's April 15th.
Oh, God.
You got anything else, Dr. Martin?
No. Why'd you say that?
Well, because I gotta, I'm trying to be there's gonna be like timestamps in history.
Okay.
Like, at this moment in history,
Everyone's going to see my face.
this thing happened. Oh, you won't file your taxes like September.
Yeah.
You got the extension.
I always get the extension.
You're
They're
fine.
like, you're way too complicated, man. You got to really work through this. I'm like, oh, that makes me feel a lot better. Yeah. Thank you.
Yeah. Well, hey,
Yeah, liposuction's probably the most common surgery we do. The top three are going to be breast augmentation, blepharoplasty, and probably the liposuction. Every year, that always falls within the top three.
look at our specific episodes on those for the statistics.
It's so bad to say.
So
stats.
you know for sure.
Say stats.
Stats. That just makes me think urgent.
So there's going to be a lot of people hopefully watching this and learning and understanding things that are true or not true. But I will say one last thing. It is an amazingly transformative procedure. Our patients are really happy with the results. We love what we're doing now. I don't know why I'm hamming up. It's what I'm making
like,
a point.
I know. I'm like, yeah.
Yeah.
Call to action.
Yeah, I know. And I got my fist in the air like I'm about to start a revolt.
Right. Get your liposuction now. Liposuction for life.
Come on, you can do it.
Hands on the face.
So we use energy-assisted devices, specifically now body tight, but we also have beauty fill for fat grafting, which does have some skin tightening qualities. So we're very pro liposuction.
Lipo's great.
Yeah.
Get rid of the fat
We
you
love
don't
it.
like.
Educate yourself, know what you're getting into, but you're going to have a great result if you go to someone who knows what they're doing, preferably a board-certified plastic surgeon. Amy, do you have anything else to say?
You can find all of our social media links right here.
We already did that.
Thanks to Nils. I'm going to put them here again.
Okay.
Love your comments, ratings, reviews. Share us with all your friends. Bust some myths for your friends. Get your lipo.
You had to bring up the taxes.
See you next time.
See you.